The Minnesota Department of Health is on the defensive tonight as state Republicans are criticizing the model for tracking the spread of the coronavirus. Today, the state defended its model and predicted that nearly 22,000 people will die. Valley News Team's Joshua Peguero attended the media briefing as Minnesota health officials say their model is a work in progress.
The state of Minnesota took a step towards being more transparent by releasing the model Friday they're using to make decisions on battling COVID-19. Models are what government officials use to track the disease and project where it is heading.
They are not about specific point-in-time estimates. They are about directional changes.
But amid all the social distance policies the state has enacted, including extending a stay-at-home order until May 4th, Governor Tim Walz is being criticized by the Senate Republican leader for his decision. The model Walz is relying on is a partnership between the University of Minnesota and the Department of Health.
We think we're farther along in the epidemic, number one, and number two, that we think there are many more infected patients out there than we have been estimating to be.
With businesses hurting in Minnesota, health officials say their model does not take into account the impact on the economy.
This is about the COVID-19 disease and how it progresses specifically. This is not a model that attempts to model out economic impacts or impacts on other health conditions.
The plan of action Minnesota has taken expects 22,000 people to die from COVID-19, and it does not plan on hitting its peak until July. To put that into perspective, since March 21st, 57 people have died in Minnesota. Health officials acknowledge their model is pessimistic. They also say this decision will extend the spread of the coronavirus well into the summer, but it will be at a lower rate and hopefully save more lives. Joshua Peguero, Valley News Live.
We've filed an open records request for projections and data on the model, and they have not fulfilled our request. The body